So me and Swan did the test of early grammatical impairment, and it is a clinical tool that's used to identify, diagnose, and screen and do follow-up evaluations of grammatical deficits in young children who speak standard American English. It's administered to kids that are between ages 3 and 8 years old. It focuses on finite verb morphology, which is the area of grammar that's commonly difficult for kids with specific language impairments, and it's a promising area for accurate diagnosis of this. It looks at the mean length utterance, which is the number of words or morphemes in each of their spontaneous utterances, and it is one of the most indicative indices of language acquisition in young children. So children who have specific language impairment are significantly less accurate when they produce morphemes with tense, like third person singular, past regular ed, than morphemes without tense, like present progressive ing and prepositions in and on. So if the child's MLU is one standard deviation below the mean, then it's indicative of a language impairment. And the test of early grammatical impairment should be used with other assessments that assess vocabulary and speech development to make sure they get a well-rounded idea of what's going on with the child.
All right. The reliability of this test was done by doing a test-retest reliability, and it was done with a group of 106 children aged from 4 to 4 years 11 months, and the test was given twice to the group, and it was given by the same examiner, and the age range was the date range was 7 days to 21 days. The test-retest values for core probes in the elicited grammar composite was 0.82 to 0.95, and grammatically judgment probe was different for each age group, which there was a younger group and then older group. For the younger group, it was 0.37 to 0.44, and for the older group, it was 0.65 to 0.82. There was a lot of validity that was assessed. The first one was content relatability, and this was determined by conducting research on children with specific language impairments, which was done to actually create the test. The next area was internal structure, which was determine the relationships between each area of the test and to determine that there would be like a moderate to low correlation, and it was actually a moderate range of 0.4 to 0.6. And then another form of validity was convergent and discriminant validity, which is to determine like high correlation or no correlation between tests that measure the same thing as the test of early grammatical impairment. But the test of early grammatical impairment is its own format and theoretical construct, so there's actually no other assessment that matches it. So in order to determine construct and discriminant validity, the TEGI was compared with subtests of the self-3 or self-preschool. For sensitivity and specificity, the kindergarten age range was the mean for sensitivity was 0.9 and specificity was 0.8. For the age range of 4, the specificity values was at 0.78, and for sensitivity it was at 0.9. Tester qualifications included 180 SLPs, childhood educators, educational diagnosticians, and psychologists that participated in a research study to determine reliability and validity. And during this time frame, the Psychological Corporation evaluated each examiner as they gave the test to determine that they were giving it correctly and that the results were scored correctly. And afterwards, the assessments were still monitored to determine that all data collected was reliable and accurate.
Okay, and so when they standardized the test of early grammatical impairment, there was typically developing children and language impaired children in the study, or in the standardization process. So the typically developing children, there was 393 children with typically developing language skills between 3 years and 6 years and 11 months. And there was 444 children between 3 years and 8 years and 11 months. And so the kids that were in the that were not in the typically developing group were already diagnosed with a language disorder. And so they also had the other inclusion requirements of having adequate hearing and vision and living in a home where they speak at least 75% English all of the time. And they were required to take the test in English in a standardized fashion, as well as pass a phonological probe. And to be included, the child had to speak standard American English, which means that their spoken language is relatively unmarked with respect to regional or, in some cases, dialectal differences in English. So people who speak a dialect such as African American English or Appalachian English might leave out some grammatical structures, and the grammatical structures might not be required in that dialect, so they would not be considered for the standardization process. So we would recommend using the test of early grammatical impairment because there's been multiple studies that indicate that the child's use of grammatical morphemes is representative of the lack thereof or presence of NSLI. The specificity and sensitivity are within an acceptable range, so we believe that the assessment is a valid and reliable measure to assess children who may have a language impairment. Their score on the assessment is also a good indicator on how they might do on other assessments of language, but because it only assesses morphosyntax, it should be used in conjunction with other assessments of language that evaluate vocab and speech development to get an overall understanding of the child's language capabilities. So our tests consist of 5 different subtests. One probes for phonological aspects, another for the use of third person singular, another for the use of past tense. They test for both be and do, and there is a probe for grammatical judgment. And I'm 3.
So for this assessment, as the client is 3, we will not be doing the grammatically judgment probe, as that's for 4 and above. So we're going to start with the phonological probe. What is this?
Horse.
What is this?
Bus.
Okay. Now we're going to do the third person singular probe. Here is a dentist. Tell me what a dentist does.
He fixes teeth.
This is a police officer. Tell me what a police officer does. I can't see it. Next subtest will be assessing third person singular. This is a dentist. Tell me what a dentist does.
He fixes teeth.
Good. This is a police officer. Tell me what a police officer does.
He keeps us safe.
And now we will be assessing be and do. Look at the bears. I wonder if the bears are resting. Ask the puppet.
Are they resting?
I'll find out. Yes. I wonder if the kitty is resting. You ask the puppet about the kitty.
Is the kitty resting?
Good. Thank you for watching our video, and I hope you learned a lot about the test of early grammatical impairment, and that will help you decide in the future if you would like to use it.